Hello, I'm Life Coach Bill. Let me share with you a humorous and satirical view of the situation we are in. COVID-19 is not the only pandemic facing us. There's another pandemic that is just as vicious and debilitating that has been infecting our world since the beginning of our time. Let me explain how the treatment for this other disease flies in the face of the treatment being recommended for the coronavirus that we're currently battling. It's pessimism. Stop the spread. In this public health announcement, you will come to know the symptoms of pessimism, the root cause, what you need to do to stop the spread, places the virus thrives, and how to treat symptoms and care for someone with this infliction. Pessimism is a disease caused by negative thinking, and it can range from mild sadness to severe depression. Now, the most common symptoms include, but are not limited to, insecurity, unworthiness, anger, fear, despair, doubt, distress, and anxiety. Complications from pessimism can include serious conditions like sorrow, total negativity, hopelessness, worry, blame, feelings of worthlessness, and in severe cases can lead to self-immobilization. Here's what you need to know. Pessimism is spread mainly from person to person through close negative idea exchange. Transmission can easily occur in daily interactions. For example, visiting your local coffee shop or where union workers, politicians, or farmers hang out. Other commonly known high infection air sources are the radio, CNN breaking news and their affiliates. Remember, the infected often congregate together, often in large groups, finding comfort in their misery by surrounding themselves with others that are often even more severely inflicted than themselves. Their misery seems to love fellow company. This is just one of the examples why this disease is so hard to eradicate. Now, there is no clothing or garments that protect you against pessimism, but there are things you should do to help prevent the spread of this negativity that causes this infectious disease. I'm sure you've heard lots about physical distancing, and everyone should practice physical distancing to reduce their exposure to negative thinkers. This means staying at least 2 meters away from anyone until you know they're not infected. And if you believe you have come in contact with this virus, you should track how you feel for at least 14 days. Take your mental temperature daily. Is it lower or higher than normal? Record any feelings of envy or bitterness, being crabby or angry, jealous, just to name a few. And share this information with your caregiver. Currently, there is no man-made injectable vaccine that protects us against this virus. But there are treatments for this form of negative thinking. The good news is many people who do get infected can recover with little or no scarring. Let's talk about treatment protocol. Typical treatment for these common forms of negative thinking include drinking plenty of fluids. Wine is my favorite. Exercise daily. Again, another of my favorites is dancing. Dancing with pretty ladies. It helps with all that important, blood flow. Get as much rest and sleep as possible. Use a humidifier or take a hot shower with a friend. That'll help keep your mind off any negativity. If you begin to feel the symptoms of negative thinking, you should immediately put on some good clothes. Get out of the house. Socialize with the non-infected. And if at all possible, spend time with anyone that has a smile and seems to be enjoying life. And remember, only call 911 if it's a true emergency. Now, for everyday actions, take these everyday steps to reduce exposure to this infection and protect your health and that of your loved ones. First, practice good hygiene. Wash your head often, especially between the ears. This helps keep your mind clear and open. If you feel sad, cry into your sleeve. Start hugging others with gusto, or any other Mexican. Avoid contact with people who are pessimistic, and get out of your house if you're feeling down. And find others to lift you up. Now, through exhaustive clinical trials, we have found the best way to stop the spread of pessimism and other forms of negative thinking are by staying positive, being optimistic, surround yourself with happiness and joy. This is key if we ever hope to eradicate this terrible disease. Now, I've been asked, do face coverings and face masks help? Yes, but only certain types. Consider using a face covering, a non-medical mask, such as a clown mask or a funny bandana, to reduce the risk of transmission of negative thoughts. Just one humorous action can reduce the transmission of this disease. Funny face coverings will not only protect you from getting infected, it is also an effective way to treat others with this illness. Please exercise proper protocol. Practicing proper laugh and squeeze etiquette. Now, for example, laugh. Laugh until you cry. And squeeze. Squeeze when you give hugs. For your safety and the safety of others, I encourage you to share this important information with family and friends. Now you know the facts about pessimism and its family of negative thinking viruses. You can go forward knowing what to do in this crisis. And with your help, we can all live in a world full of joy and happiness. It's your responsibility to help prevent this spread. Be safe, be happy, hug a friend. This public health announcement has been brought to you by Life Coach Bill.